morning, good evening, good night, everyone. Welcome back, Agers and Thrivers, family caregivers. Welcome to Conversations with Dr. Lana, me, specialist gerontologist, where we talk all things briefly on aging and things that can affect you from head to toe, literally. Of course, we're in Breast Cancer Month. Hope you're wearing your pink pin in support. And if you are going through a time where you're being diagnosed or under treatment or post treatment and in remission, good health to you from all my heart. Now, the question I'd spoken about was some posts I'd made was about screening after 70. I'll send the link below. But that's a consideration because some of the studies are suggesting that within the realm of family history, within the realm of, what can go wrong will, or if you happen to feel a lump after age 70, is there still a role for mammogram? Which brings me to what I'm going to talk about today. When and should you get a mammogram? From what age should it start? Why does it matter? Why are the guidelines the way they are? And what do you do? So the average, depending on where you look, is 40. From age 40 to age 44, you should have your mammogram starting. Why? Because breast tissue starts off dense with the full periods and everything is from time you hit puberty till about that age. Breasts are kind of thick, fibroglandular, we call it, dense tissue, thick ducts, ready for childbirth, that sort of thing. And they can feel what people call lumpy, but that's because it's firmer. So it doesn't just sag as you get older. That's not what happens. What happens is that the fatty tissue kind of replaces that denser tissue, and so it's easier to see on mammogram. So, and that happens from around age 40. And that varies from person to person, but generally 40 to 44, you get your test and it's advised every 2 years. From around 50 or so, once a year is fine, unless you've had an abnormal test. Now, what happens in between that gray area of 65 to 70 and over? Well, the breast can feel fattier, softer. It's easier to see on mammogram. But if there is any suspicion of a lump at all, never mind your age, never mind what you're thinking. It should be advised to get a mammogram or ultrasound or the two to combine. Why? Because no one size fits all, and we want you to be as covered as possible. So stay healthy, stay happy. From my heart to yours. Bye-bye.